We have been monitoring this situation very closely since yesterday, based on the information that the South African authorities have been very openly and rapidly sharing in South Africa. It looks like this particular variant has a very concerning set of mutations, especially in the spike protein, which is needed for its transmission properties, as well as its the protection against the vaccines. So based on the genetic information, we are quite concerned about it. However, the epidemiological information that we get over how much this particular variant is spreading in South Africa right now is very uncertain and very unclear at the moment. So we are monitoring it very closely. And we aim to have a threat assessment of this done by the end today to inform our member states and the European Commission of our reading of the situation.
Pasi, can we just talk about the threat of a variant in context here? Because there had been hope that vaccinations would slow mutations. And I gather scientists were thinking that slowly over the course of a decade, we may see some form of evolution in COVID where it can get around the immune system. But the black swan really is some sort of super mutant variant that can manage to get through some of the vaccines straight away. Is that how you sum it up? That is the sort of worst case scenario, if that is what we're dealing with here?
That is, you use very dramatic words in your introduction there, but that is what we and the scientific community is concerned about. These mutations that we see from a limited number of samples in South Africa appear to suggest that it may be evading previous immunity from previous infections, as well as immunity provided by the vaccines, which are rolling out very rapidly in Europe still as we speak, but also evading potentially immunity provided by some of those new treatments that we are starting to see coming online, the so-called antibodies, monoclonal antibodies. So there are a lot of concerns in there based on the genetic profile of this virus that the South African authorities and laboratories have been very actively and proactively sharing. But we still have a lot more to learn about the situation in South Africa, and all the efforts should now be focused on not only South Africa, but countries in the Southern African region to ensure that they get a full picture of this virus. They're able to clamp down as much as possible on the transmission of this virus, and thereby protect the rest of us also from any potential consequences.
Pasi, there are so many moving pieces when it comes to the European health situation at this stage, where you've got some countries adopting stricter measures. I mean, the strictest in Austria, where you do have this 20-day lockdown anyway. And I think a lot of countries have stepped back from life as usual with more restrictions for winter. So what does it mean as we deal with a variant like this? Is the population slightly more protected than if they were just circling as per normal as we went into this pandemic?
So I think it's very important now that we separate the two concepts. The situation in Europe right now is really focused around the rapid transmission increases for the Delta variant, which is practically the only variant that we're circulating in Europe. The vaccines that we have available in Europe and authorized by the European Medicines Authority are extremely efficient on protecting against severe disease, death, and hospitalizations, and they remain to do that at very, very high levels. Despite that, with the current levels of vaccination, and even in those countries with high levels of vaccination, the virus continues to circulate and cause important pressures in the healthcare system, partially because of those who have not been vaccinated. And for those countries with a low level of vaccination, that's the majority of these cases, but also partially through to breakthrough infections of vaccinated individuals. Those are normally the more elderly, the ones with some issues in their immunity, people with pre-existing conditions. So we see right now extreme pressures, an increasing difficulty in the epidemiology in most EU countries, and based on our modeling, we see that we cannot avoid these non-pharmaceutical measures being implemented in a number of countries if we want to contain the transmission over the Christmas period. That's very unfortunate for us here at ECDC, for the whole population of Europe, and many of us personally. But we just cannot give up this game yet.